Hi, I'm Guillermo Garcia-Manero from MD Anderson, and I'm going to be talking about this recent data presented at the ASCO meeting that is going to be updated at the EHA meeting in Milan in terms of the survival impact of luspatercept in patients with low-risk myelodysplastic syndrome, transfusion-dependent, receiving this drug as their first line. I think this is actually transformative data. This was a pre-planned analysis on the COMMANDS trial. Remember, this was the randomized study of luspatercept versus an ESA, epoetin alpha. The main endpoint of that study was response and increments in hemoglobins, but secondary endpoints included actually survival of those patients. Why I think this is really transformative, almost a paradigm change, is because traditionally when we design clinical trials for lower risk MDS, we don't think about survival. We don't think about improving the survival of our patients treated with these modalities. And now for the first time on a phase 3 study, although a secondary endpoint, we're starting to see that those patients treated with luspatercept have a significant longer survival compared to those treated with epoetin alpha. Again, this was presented at the ASCO meeting in Chicago. And now the question for us as investigators are number. Number one is why? Why a drug that does not change the molecular structure or architecture of the disease is associated with this effect? So we really need to understand the biology behind this. And second is, how do we make this better? Is there a potential for some type of combination that together with luspatercept could bring us to a response rate, let's say close to 80-90%, that could really now, in a very significant way, improve the survival of our patients? I think this is what we need to start thinking. Remember, majority of patients with MDS will present with lower risk MDS, and if we act at that moment, we may be in a situation to really change the natural history of the disease. Thank you very much for your attention.